Hey everybody, Dr. Tim Terlep here. Welcome to this week's 3 Minutes to Vitality. And today we're going to touch on something with omega-3 fatty acids, one of our core 4 supplements here at the office, which is of course omega-3 fatty acids, a plant-based multi, a probiotic of extreme quality, as well as vitamin D levels. But with omega-3 fatty acids, just going to touch on it this week because we actually have a couple of new studies it just again shows the efficacy, the reason why omega-3 fatty acids of quality are actually a part of our core 4. And 2 of these, and before we do that, let's preface, every one of the studies that we look at actually uses something called an omega-3 index. A very simple blood test. When we do it here at the office, we don't have to use a needle or a vial or a vacuum tube or venipuncture and use a tourniquet. We don't have to do any of that. We literally just use 1 drop of blood, right? Which is just so easy to acquire, completely painless. Right, and 1 drop of blood will allow us to have enough information to get to the laboratory to get this result. So omega-3 index measures the level of omega-3 fatty acids, the 2 big ones, and we're not going to use the big words, as EPA and DHA, that we have in our blood. It measures the amount of these lipids, these fats, in the membranes, the cell wall of a red blood cell, which tells us it's a general indicator of the systemic levels in our bodies. Right, and so every time we do this, people go, oh, I take it. Well, I'm glad you take it, but that's like saying I have a car, right? So I can have a car, but it's a 1981 Yugo and it's rusted out. 1 tire is flat, and anybody who remembers the Yugo knows what a horrible vehicle it was. Or it could be a 2020 Mercedes SL 550. Wow, what a difference. They're both cars. If I said I had a car, extreme difference. And one's an automobile and one is a conveyance of some kind, right? But they're both called cars. So omega-3s, we have to make sure that we're getting the right level. Now, these 2 studies that have come out, just to sum them up, why it's so amazing, and these are just 2 recent ones of a veritable plethora of studies that document why this is core and essential to your and my health on a day-to-day basis. One of them was actually looked at, it was actually a women's health study that was looking at hormone replacement therapy, but they were measuring lots of other stuff. And they looked at 6,500, 7,000 women over the course of 15 years. And what they found is they looked at these women, and they were looking at cognitive stuff, but these other data they pulled out, they looked at omega-3 index. Well, the ladies who were under 4, which is the level that is actually, it's 4% of these essential fatty acids in the cell wall membrane, that's what that means, right? A 4 on the omega-3 index, the women versus 4 versus an 8. An 8 to 12 is the range that we're trying to get to on the omega-3 index. So the women who were at 4 versus the women who were at 8 or up. Over the course of the 15 years of the study, they found that the women at 4 were 31% more likely to die over 15 years than the ladies at 8 or up. That's a little dramatic. How'd you like to decrease your risk of dying by 1/3 over the course of 15 years? That's pretty significant, pretty amazing stuff. And what's really remarkable is this was for ladies who were actually 65 to 80 years old. So, and what happens if we actually had these for people who are 20 to 40 and their omega index was that and they continued? Wow. The chemoprotective benefit may be absolutely dramatic. The other one that we want to look at as well, which is pretty great too, there's actually something called a condition called acute coronary syndrome. And they looked at a bunch of people, 2 groups that had it. And again, we won't get into the construct of the study, but essentially what we looked at is that the people, again, if we use the omega-3 index, and this particular study also compared people at 4, which is the average American level, or at the level of 8. Again, what we see as average for people who are at optimum, the lowest level of normal. They compare those people with this thing called acute coronary syndrome, ACS, which includes heart attack, uncontrolled angina, arm pain with dizziness, a bunch of it. It's the syndrome of acute coronary presentation. Makes sense, right? So they looked at these at 4 versus 8, and what they found was a 70, yes, I didn't stutter, a 70% reduction in acute coronary syndrome presentation, heart attack, right? For the people who's actually were at 8 and higher for the period of time of the study. Dramatic stuff. And this is just a couple of studies that we have that really help tell the tale. So I wanted to bring those to your attention again, and it helps to understand why the omega-3 index, and we'll hit on that some more, becomes such a critical factor in our health and our well-being as we age and on a daily basis. So sure appreciate your watching. We'll see you next week. Thanks much.